here. My name is Mary Kate. I am a board-certified music therapist, and I'm here to talk to you a little bit about what music therapy is, different places that you can work as a music therapist, and what the pathway looks like to become a music therapist. So just to get a little bit of an idea, raise your hand if you consider yourself a musician. Okay, so those of us who, engage in music, you might not be aware, but it has probably impacted your life in some way. And learning music and engaging in music on a regular basis changes your brain, it changes parts of your body, and it can actually be therapeutic. So that's where music therapy comes into this. As a music therapist, I work with people to rehabilitate a variety of different needs through music. To benefit from music therapy, you do not have to be a musician. You don't have to have any musical training. And my job as a music therapist is to make music accessible to you and to make music therapeutic. So we're going to start here. Music therapy. So like I said, we're going to do a comprehensive overview of different areas that a music therapist works. So we're going to start off. What is music therapy? So the definition is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. So that definition is a lot, but the main points are a credentialed music therapist who's completed a program. So having music on your playlist and listening to it because it helps you to calm down, that's good, and that's music wellness, but it's not music therapy. Music therapy is within that relationship with a music therapist who's been board certified. So some key components. Music therapists use assessment, treatment planning, intervention, and evaluation. Sessions may include active music making, receptive listening, songwriting, improvisation, and movement to music. So each session will look completely different based on what the goal areas are. You may use songwriting in 2 different sessions, but have completely different goals. And that's one of the things that keeps my job very interesting, is we're constantly innovative, we're constantly changing the things that we do, and we're constantly growing. And then credentialing. So music therapists in the United States hold MTBC credential, Music Therapist Board Certified. So this requires a bachelor's degree or higher in music therapy, 1,200 clinical hours, and passing a national examination. So the next slide, we're going to go through a little bit more detailed of some of the different pathways that you can take to become a music therapist. So starting at the top, you need a music therapy degree. There are undergraduate degrees, 4-year degrees. There are equivalency degrees. So what that is if you have a degree in something, a bachelor's degree in something other than music, or other than music therapy, you can go back for an equivalency degree. And what that does is it gives you all of the classes that you might have missed in your other degree that fit into the music therapy degree. It gives you those classes, then you do your internship for 6 months, and then you go on to complete the master's coursework. So at the end of it, you have a music therapy board certification and a master's degree. And then lastly, there's also graduate programs. So just master's degrees. Say you have a bachelor's degree in music therapy and you want to specialize and study something a little bit more intensely, you can go on to get your master's degree in music therapy. 1,200 clinical fieldwork hours. So throughout your bachelor's degree, part of the coursework includes things like theory, musicianship, music history, the things that are required to get a music degree, to get a bachelor's degree in music. For music therapy, you'll also have classes like musicianship relative to music therapy, learning about different interventions that you can use, techniques. You'll take some sort of psychology and anatomy class to start to learn more about some of the ways that you can impact people with music therapy. And then towards the end, or at the very end of your bachelor's degree, you'll complete a 6-month internship. So this is where you get to kind of choose where you would like to study more in depth. And some people are interested in working maybe in a hospital. So they might find a hospital that's offering an internship, and you can spend your time there learning from someone who is a board-certified music therapist how they implement their practice. And you get to start practicing as well. So you get to start doing things, and you have someone who's with you, who's guiding you along the way. And then lastly, the fun part, the board certification exam. Not really, but you have to complete the board certification exam. You can take it multiple times, but you do have to pass it in order to get that board certification to start practicing. And that is how you become a music therapist. Some of the different schools in Texas that offer bachelor's degrees, we have Sam Houston State University. That's where I went for my master's equivalency. We have Texas Women's University, Southern Methodist University, University of Incarnate Word, and starting in the fall of this year, University of Houston is starting a music therapy program. So that's something that's really exciting. One that I forgot, and I just realized while I was talking to Melissa over here, St. Mary of the Woods. Okay, that's another one. So there are schools in Texas that offer music therapy degrees, and they're growing. There's more. And I'm really excited about the University of Houston program that's opening soon. So we're going to start off talking a little bit about music therapy in the medical setting. So this is where I work currently. I'm a music therapist at Houston Methodist in Houston. I work with oncology patients on the bone marrow transplant unit. And in the past, I've worked in pediatric hospitals. I worked at Shriners Hospital in Galveston, and I've also worked in mental health hospitals, so Woodland Springs in Conroe, Texas. So acute care, some of the different ways that you can impact care as a music therapist working in a hospital is you can reduce anxiety and pain during procedures. This is a big part of what I do. When people come to my unit, sometimes they have to get a procedure called a bone marrow biopsy. And it can be very anxiety-producing and very painful. It's a procedure where they have to essentially drill into a bone in your back and harvest some of the bone marrow from inside of it. And the patients are awake during this. So the way that I work as a music therapist is to help alleviate some anxiety coming into the procedure. Some patients like to do that through music distraction. We'll sing, we'll play instruments, we'll make playlists. And then during the procedure, I will be in the room with the patient and guiding them through breathing, letting them know what's going on, and playing music to help them relax. Other ways is through emotional support. You can actually stabilize heart rate and blood pressure. And then for our patients who are in the ICU who might be on a ventilator, the machine that kind of helps breathe for you when your lungs have been compromised. When they have to eventually wean you off of that ventilator, it can be a really distressing process, and it can make the patient very anxious. So oftentimes the music therapist will go in there while they're doing the vent weaning, and they'll help them to stay calm, and they'll help them to focus on their breathing. And the way that we do that is we talk with the patient's family. We talk with the patients if we're able to. We start to establish an idea of what are your preferences, what's your relationship with music, how do you react to different types of music, and we create an individualized plan for that patient to be able to reduce anxiety and get them off of the ventilator sooner. So pediatric units. Kids have to go to the hospital too sometimes, and that's really hard because kids learn by exploring their environment, and being in the hospital is a very isolating experience. So music therapists who work with children in pediatric hospitals, they engage children through play and creative expression, reduce anxiety, support emotional and cognitive development. Again, it's really important that kids are given the opportunity to explore and to investigate their environment. And by bringing music into that, they can play instruments, they can sing, they can do things that other children are doing and normalize the process a little bit. Rehabilitation. So physical rehabilitation. Music therapists work alongside physical therapists, occupational therapists, to use music to help to rehabilitate different physical needs. So it can help to improve gait training. So gait training is getting kind of like more of a normal walking pattern back after maybe you've had like a traumatic brain injury or a stroke. Sometimes your walking can be a little bit uneven, or you may have a lot of weakness. So music can actually help to regulate that. And it can, using rhythm and different harmonic cues, you can actually help to make that a little bit more of a regular pattern to reduce things like tripping and falling. Also language. Music is very closely associated with language, and it can be used to rehabilitate language. And we're gonna see a little bit more of that in the coming slides. I have some videos. And then lastly, we have NICU. So NICU is neonatal intensive care unit. So these are typically babies that are born too early or babies that are born and need a little bit extra attention for some reason. When a child is born prematurely, you have to consider that they should still be in the womb, right? They should still be inside of their mother at this point. And so if they're born early, maybe all of their senses haven't developed completely, and the environment can be really overstimulating. If you've ever been in a NICU before, you might have noticed it's very bright, it's very loud, and there's not a lot of comfort. And for infants, this can be really tough. This can be really difficult, and it can impact them going forward in their life as well. So a music therapist can help by bringing in a comforting stimulus. Raise your hand if you have an idea of what kinds of sounds or music a premature infant might like to hear or might help them to regulate. Anyone have any ideas? Yeah. The sound of their mother. You nailed it. Yes, exactly. And think about what they're used to hearing, because infants can actually hear inside of the womb. They can hear some of the external sounds that are going on. They can also hear their mother's heartbeat, and they can hear their mother's voice. And so the cadence of the mother's voice is really important. If the mother sings while she's pregnant, the baby hears that, and that becomes some of the first music that they start to remember, and it becomes the thing that can comfort them the most. So as a music therapist, you can start to help the babies to self-soothe by incorporating some of those aspects of mother's voice, the sound of heartbeat, and the songs that the mother was listening to and singing while she was pregnant. And so I'm gonna show y'all a quick video. This is actually about a device that was developed and music therapists use in the NICU. And what it does is it encourages infants to learn to suck, which is a very important thing. That's a reflex that they develop while they're in the womb. But if you're born prematurely, you may not have developed that, but you still need that. So we're gonna watch a quick video. Let's see. Let me switch screens real quick. Give me 1 second.
Having to go home while their triplets stayed in the NICU was a helpless feeling for Yana Gallus and Gregor Martinez.
Every time, to leave them there, it is very hard.
Then they learned of a new way to help their babies even when they couldn't be at the hospital. Researchers at UCLA Mattel Children's Hospital are studying a device called Pacifier Activated Lullaby, or PAL. It plays a lullaby written and sung by the baby's parents when they successfully suck on the pacifier.
They love it, especially when they hear their parents' voices. They want to keep performing.
This is critically important for preemies born before 34 weeks who often struggle to feed because they haven't developed the reflex to suck, breathe, and swallow.
Sometimes that's that final thing that needs to happen before an infant is discharged from the hospital, is their ability to feed orally with strength and endurance.
70% of preemies improve their proficiency using a emotional distress while their babies are in intensive care.
There's a role for you to play that no one else can fill that void, and it's critical, and it's powerful.
It helped us as parents, I think, just as much.
With the help of the PAL device, all 3 of the triplets fed better and grew stronger. And were able to go home together at 52 days old. Now they are healthy babies growing by the day.
This guy eats like 10 ounces sometimes.
And their parents say music continues to influence their development just as it has since their first days in the world.
They are all healthy, and that's, there's nothing more we could wish for.
At UCLA Mattel Children's Hospital, this is Barb Consiglio reporting.
So you can see how that relationship with the music therapist, not only helped by using the device and incorporating mother's voice and offering a way to reward their sucking, but also after the baby was discharged, they were still able to continue to build that bond with their parents through music. And then these are just some pictures. The one on the bottom is me when I worked at Shriners, working with a patient in the music therapy studio there. And then the one above that is Melinda. She's the music therapist who worked there before me. Okay, so we talked a little bit about inpatient rehabilitation and neurologic music therapy. So neurologic music therapy is an additional certification. So after you get your board certification, you can go back and learn this specialized training. And it teaches you more about how music impacts the brain and very specific techniques that you can use to help people rehabilitate speech, cognition, and physical movements. So with motor recovery, you can use rhythmic and melodic cues to support gait training and upper extremity coordination for stroke and traumatic brain injury patients. So helping to rehabilitate some of that movement. Sometimes patients will be left with weakness on one side of the body or lack of coordination, and music can help to regulate that. Cognitive rehabilitation, musical activities enhance memory, attention, and executive functioning during neural recovery. Sometimes you don't realize it, but your brain does a lot. And so when you have an injury to your brain, it can impact a lot of different areas. Luckily, music also impacts a lot of different areas in your brain, and that's why it's such a great tool to help rehabilitate. Emotional support. Having changes in your ability levels, whether it be speech, memory, or physical movement, can be really distressing. And a lot of the things that you're used to doing day to day may not be possible anymore. So also providing a space for that emotional support is really key. Speech rehabilitation, using techniques like melodic intonation therapy and MuStim. So these are specific neurologic music therapy techniques that help to rehabilitate speech. We're gonna see a couple of examples here. So this is a video. Both of these videos were taken from the place I work, Houston Methodist. We have a music therapist who works in inpatient rehabilitation. And he was able to get some videos of the impact of music therapy on some of these patients. So first we'll see motor recovery. Sorry, I'm not sure why it's being difficult. Here we go. So this is a patient who had a stroke, and after her stroke, she had a lot of irregularities in her gait pattern. So you'll notice the first part of the video, she's walking, and her gait is really uneven. There's kind of like a hitch to it. And that's a problem because it can cause falls. It can cause people to trip, and that could cause a further injury. So we really want to prevent that. And then you'll see, after working with the music therapist, what her gait looks like. So you can see those short steps with the right foot. So you can see how much more even and regular the steps were with the added music. One thing you might have noticed is that her steps were not exactly on beat with the music that he was playing, and that's okay. The idea is that the music therapist is providing a regular, steady beat, so he was probably even listening to a metronome in his ear and playing that regular, steady beat. And even if the person is not completely matching to it, this isn't marching band, we're not going to take off points, right? You're not right on the beat. It's still beneficial, and they still benefit from that steady beat. Okay, now let's see if it's going to let me open this one. So this is an example of melodic intonation therapy. You'll notice the patient is someone who had a stroke and is receiving therapy to rehabilitate her speech. That's one of my coworkers, Jonathan, and he's working with this lady to help her to practice functional statements that she might need. And this isn't a different language, so you might not recognize the statement, but it means to say hello. So did anyone notice that there was kind of like a progression that he did? He started off by just humming the melody. And then did you notice both of them were tapping their hand? She was tapping her left hand on her thigh. So that's part of melodic intonation therapy. You tap the left hand because it activates the right side of your brain. And the right side of your brain is where the language center is. So that's the part that you're trying to activate. And using melodies helps to kind of bridge that from the left to the right side so that you're building new pathways in your brain rather than trying to use the ones that were damaged. So you saw he started with humming, and then he had her join him in saying the phrase and singing the phrase, and they sang it together. And then he stopped, and she sang by herself repeatedly. And then he did a call and response where he would say the phrase, and then he would have her say the phrase. And all of those different steps are kind of practicing different things. Sometimes the problem is with initiating speech, and so that's why you end with the call and response. And then the final stage is saying the phrase rather than singing the phrase, and that's how she ended. So that's what melodic intonation therapy looks like. Okay, Next, we're going to talk about hospice and palliative care. So this is music therapy working with people at the end of their life. So music therapists who work in hospice and palliative care, sometimes they work in the hospital. Sometimes they also work in private practice and they do home hospice or go to a hospice facility. A lot of what music therapists do at this point is they manage pain. Some people have pain due to whatever diagnosis they're dealing with, and sometimes it can be really hard to control. So music can act as an alternate stimulus, and it can also help people to relax so that the medication they are receiving is more effective and it's able to be dispersed throughout their body, through their bloodstream more effectively. Also, family support. You know, when a loved one is nearing the end of their life, that's a really difficult time. A music therapist can work with the family to help work through some of that grief. They can also work with the patient to do some legacy building. Legacy projects might look like sometimes we write songs with patients. Sometimes we put together playlists for them to leave to their families. Sometimes we will do heartbeat recordings. We have a special stethoscope that we can use to record patients' heartbeats and use it as a beat in a song. So these are all things that the family can have after the patient has passed to remember them by and to remember that connection that was really special. And also spiritual comfort. A lot of families, you know, find comfort in their spirituality, and music is usually a large part of that. So being able to support that is really important. Mental health care. So my first job was in inpatient mental health, and that's where I did my practicum as well. And when patients come into a mental health facility, usually they're in a crisis, and there's something that is really difficult that they're going through. So music can work to acutely stabilize these patients. We usually will do groups on units, and it can help to even like make the connections between patients more harmonious to share a musical experience. So music therapy works alongside the interdisciplinary team to help stabilize patients when they're admitted. And it can help to alleviate some of the depressive symptoms, suicidality, auditory and visual hallucinations, paranoia, psychosis. And music works really well to ground people in reality. And sometimes in those groups, you'll see a different version of the patient, and you didn't realize, oh, this is their personality. They were just presenting with a really difficult issue that they're going through. Emotional regulation, offering opportunities for emotional expression and ways to cope with that. Like I said earlier, group cohesion, getting patients to where, you know, they're interacting with each other in a positive way. They're able to learn from each other in a positive way. And ultimately making things a lot easier to go through that experience as things are figured out with the psychologists, the psychiatrists, the counselors that all work together. So next we have memory care facilities. So music works really well, like I said, with patients who experience auditory visual hallucinations. It works to ground people in reality. It also works really well with patients who are experiencing memory loss, whether that be dementia, Alzheimer's disease. Familiar songs often remain accessible even in advanced dementia, triggering autobiographical memories and promoting orientation. This can be a really beneficial thing, not only for the client, but also for their family. Because when you have a family member who is experiencing, you know, dementia or Alzheimer's disease, it can be really difficult because you're not recognizing that person anymore, and maybe they don't recognize you anymore, and that's really hard. So being able to engage them in music and bring back a little piece of that is incredibly valuable. Cognitive maintenance. Structured musical activities engage multiple brain regions, potentially helping maintain cognitive functions longer. Communication. Music provides alternative communication channels when verbal abilities decline, allowing emotional expression and connection. A lot of times when we go into these memory care facilities, the clients have been there and maybe they can't verbally express themselves very well. That can lead to a lot of problems, including mental health issues, depression, anxiety, and isolation. Social engagement. Group singing and rhythmic activities create meaningful social interactions, reduce isolation, and improve quality of life. So we're going to see a quick video. This is actually me working in, it's my graduate practicum. So when I was in school, I did one of my practicum at a memory care facility. And so it's a little bit of a grainy video, I apologize. And I do think the sound gets a little bit off at one point, but just go with it here. So you'll see there's a couple of residents of the memory care facility, and typically they're very isolated. They kind of sit, they don't really interact with each other because they're each kind of experiencing different things, and it's hard for them to really interact with each other. So you'll see I start out singing a cappella and playing some percussion instruments, and then start handing out instruments and getting people involved. And just pay attention to any changes in the clients that you might notice. You can see she jumped in. She was ready. Switches the hands. There he goes. You can hear someone jumped in singing too. You see the staff in the back. So what were some things that you noticed that changed throughout that just few minutes of musical interaction? Everybody started to get involved. Yeah, exactly. It kind of started out, they were all just kind of sitting in the same space, but they weren't engaging with each other. And so the music was able to give them a medium where they could and where they were able to interact with each other. And then you start to see they're kind of looking around because I'm handing out the instruments, right? And a couple of them were like, when am I getting one? When am I getting one? They were ready for their maraca. But these kinds of experiences they're not an everyday experience for people in a memory care facility. So you can even see like the staff coming over and smiling and watching them because they don't see them do that very often. Okay, so now we're gonna do a little movement break. So you have two options. This is body percussion. No prior knowledge necessary at all. I'll be doing it with you. Do not fear. Do you want something easy or do you want something challenging? I agree. Okay, yay. I'm so glad. I thought I was gonna have to coerce you into the challenging one. I was like, we can do this, right? Okay. It's okay if you miss some of the transitions. This is a little bit of an idea of if you were gonna do maybe like a telehealth session, this would be a really good way to get people involved without being in the same room together. So we're gonna try it out. So I'm gonna start it and then I'm gonna show you some of the movements real quick. So there's gonna be tap with your right hand on your chest. You can try it with me. Tap with your left hand on your chest. Snap. Clap. Tap your knees. Stomp. Okay, and then there's also silence, which sometimes I swear like the music education to me will be like, shh, I'll do the shh for the silence, but not necessary. And then she's also doing it with us. I'm gonna sit right here.
The music don't stop for life. Glitter in the sky, glitter in my eyes, shining just the way I like. If you're feeling like you need a little bit of company, you met me at the perfect time. You want me, I want you, baby. My sugar boo, I'm levitating. The Milky Way, we're renegading. Yeah, 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 yeah. I got you, moonlight. You're my starlight. I need you all night. Come on, dance with me. You, moonlight, you're my starlight. I need you all night. Come on, dance with me. I'm levitating. I believe that you're for me. I feel it in our energy. I see it's written in the stars. We can go wherever, so let's do it now or never, baby. Nothing's ever too far. Glitter in the sky, glitter in our eyes, shining just the way we are. I feel like we're forever every time we get together, but whatever, let's get lost on Mars. You want me, I want you, baby. My sugar boo, I'm levitating. The Milky Way, we're renegading. Yeah, 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 yeah. I got you, moonlight. You're my starlight. I need you all night. Come on, dance with me. I'm levitating. You, moonlight. You're my starlight. I need you all night. Come on, dance with me. I'm levitating. You can fly away with me tonight. You can fly away with me tonight. Baby, let me take you for a ride. Yeah, 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 yeah. I'm levitating. You can fly away with me tonight. You can fly away with me tonight. Baby, let me take you for a ride. Yeah, 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 yeah. My love is like a rocket, watch it blast off. And I'm feeling so electric, down to awesome. And even if I wanted to, I can't stop. Yeah, 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 yeah. My love is like a rocket, watch it blast off. And I'm feeling so electric, dance my ass off. And even if I wanted to, I can't stop. Yeah, 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 yeah. You want me, I want you, baby. My sugar boo, I'm levitating. The Milky Way, we're renegading. I got you, moonlight. You're my starlight. I need you all night. Come on, dance with me. I'm levitating. You can fly away with me tonight. You can fly away with me tonight. Baby, let me take you for a ride. Yeah, 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 yeah. I'm levitating. You can fly away with me tonight. You can fly away with me tonight. Baby, let me take you for a ride. Yeah, 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 yeah. I got you, moonlight. You're my starlight. I need you all night. Come on, dance with me. I'm levitating. You, moonlight. You're my
you regret choosing challenging? Oh my gosh. Well, hopefully that was kind of fun. It's also going to be relevant into this next slide. So we're going to talk a little bit about music therapists in the schools and some of the different things that they focus on. So music therapists who work in the schools will typically go into the school, either pull out a kid or they will work with them in their music class. And they're usually focusing on things like communication, motor skills, academics, behavior. Things like impulse control are usually really important, and things like sustained attention are usually really important. These are typically kids that have either developmental disabilities or just need like additional assistance. So who can think of what are ways that body percussion video exercise would work to improve some of those things, like attention control, impulse control? What do you think? Concentration. Yeah, did you notice you were really having to pay attention because you didn't know what was going to come up next, right? And there's that natural like reward of doing it accurately and doing it with a group of people and it's all the same. And then what about impulse control? How hard is it to not clap in the rest? It's hard sometimes, right? So really focusing on what you're doing and having to, focus on controlling yourself and doing something in cohesion with a group. So some other things that we can do with music therapy, oftentimes they're important concepts that kids need to learn, but it's hard for them to remember. It's one of those things that only a song can help with. So raise your hand if you still sing the ABCs when someone asks you to say them. Yeah, I still have to too. What are some other songs that you've used to learn concepts in the past? Anyone have one? Solfege, sure. Do, a deer, a female deer. Yeah. What else? Does anyone know the state song? That's a wild one. There we go. I knew there would be at least one person. But the phrases of music and pairing it with like a familiar melody makes it to where you already know something, you already know that melody, and so adding something to it makes it a little bit easier. It also helps you to learn things in chunks rather than you're just learning A, and then you're learning B, and then you're learning C. Like, that's a lot. For 26 of those, that's a lot. But if you learn A, B, C, D, E, F, G, okay, it makes sense. That's one phrase, right? So that seems like one unit. It's easier to grasp. Rather than focusing on individual units, you can make it a little bit larger. Social emotional learning, doing things that make group cohesion. So make you feel like you're doing something with the people around you that's positive and it's a positive experience. So like the body percussion video we just did, it makes you have a positive, like fun experience with the people around you, and it makes you have better relationships with the people around you. You already have a positive association with them. And then transition programs. Sometimes focusing on, how can you use music as coping? How can you use this in your life? Maybe learning an instrument. That can serve a dual purpose of not only like attention control and impulse control, but also coping. When you graduate school, when you move on from school, that's gonna be a different environment, and it takes time to transition. So it can help with those transition programs as well. And then private practice. So private practice is really unique. You get to essentially see clients of a really wide variety of different needs. When I first started as a music therapist, I started doing contract work, and I would see clients in different geographic areas. I would drive to their home, and I would work on goals in their home. So some of those goals might have been physical. Some of them might have been attention control, impulse control, but as a music therapist working in private practice, a lot of times you're traveling. You're going to places, you're going to their house, you're going to wherever it is that they are, Sometimes you're lucky and you have a studio and they can come to you, but I would say that's the exception to the rule. That can make things really fun. It can also make things a little bit challenging sometimes, because if you're seeing a client in their house, you don't really know what else is going on in that environment. There could be dogs barking, there could be other family members, someone's cooking dinner, you know. So as a music therapist, it's really important that you're adaptable and that you're able to be flexible with those changes. Okay, and then before I introduce a special friend of mine, I'm gonna talk a little bit about the future of music therapy. So it has been an expanding field. For decades, it has been expanding, but exponentially so in the past decade. So 30% growth rate, projected increase in music therapy positions over the next decade. So we need more music therapists in the field to fill the needs. 12 new states are seeking licensure legislation for music therapists by 2030. Some states have individual licensure. What that does is it helps with insurance reimbursement, and it helps to make sure that if you seek out a music therapist for care, that they are someone who is qualified and who know what they're doing. Because if you are not qualified and you do not know what you're doing, you can cause harm. And that's something we never want, right? Especially with vulnerable populations. 65% telehealth of music therapists now offering virtual services. So virtual services are on the rise. That's been something, you know, since COVID, we've been pushed into that. And it's been a complete learning curve for music therapists, because I'm sure you can think of some like barriers that occur when you're doing telehealth. You can't do anything hand over hand. Like you saw me with the memory care facility. Some of them I had to take and do hand over hand for a little bit. Or, you know, sometimes the timing is not right. Like it's not 100% synced up. So you just have to, you know, learn to accommodate for some of those things. And then 40 plus countries with established music therapy education and practice. Lots of other countries are also expanding into music therapy. So the more advocacy we can do as a field and the more education we can do as a field, the more you're gonna see growing access to music therapy. And that's ultimately what I want, is people to have access to music therapy who need music therapy. So with that being said, I'd like to introduce my friend Luis, who is a music therapist who works in this area in the Rio Grande Valley. He's gonna come up and talk to you a little bit about his work and share a little bit about himself. Come on up.
Hello. Thank you for having me. We feel so honored for this invitation. Mary, Kate sent us an invite, and we are excited that you guys are receiving this information. My name is Luis Villarreal. I'm the owner of Health in Harmony Music Therapy. I started my private practice in 2019. And actually, it's been a ride. Because back then, the music therapy wasn't, you know, as active here in the Valley as it is now. I feel like we've gone a long way. And honestly, I really did it out of necessity. I used to be a teacher at a school district, and I actually taught math. So my path to music therapy is probably not the traditional way. I followed an equivalency program, same as Mary Kate. And basically what I ended up doing is I went back to school and I started taking my basics for a music degree, and then I transferred out to Sam Houston State. And I completed the equivalency program, and then I came back to the Valley and said, okay, so now where am I gonna work? This is not really something that's well known in our area. So we started in 2019, I started by myself, and over the past 5 years, we've been growing. We've been doing a lot of advocacy, a lot of awareness. I have a lot of students reach out and ask about what it is that we do and how they can pursue this career. I usually send them over to STC because I just really like the associate's degree in music that you guys have here. And I always recommend, I think that's a really good choice. They can get their associates, and if they decide to pursue something in music therapy, then they can transfer to university, sorry, that has the rest of the degree available. And usually that looks like, moving out of the valley. I know some of you guys love the valley, you don't want to go, but life happens, right?
You can always come back.
You can always come back. And we hope that you come back if you do decide to do music therapy. We have a lot of opportunities here. So I'm going to go through it real quick. This one? Okay, perfect. So I'm going to skip here through the roles of music therapy because you guys know that it's a big part of our lives here in the Valley, right? So Healthy Harmony Music Therapy, our mission is to increase access to specialized services. So we started as a music therapy practice, but we quickly found out that there were other related services. And we started, looking for individuals qualified to offer those within the same scope that we work in. So the way that it looks like is I'll have a client that is receiving music therapy, but he's also getting massage therapy because he has a physical condition, right? And he needs it, right? So I really love that dynamic because we're able to sort of not necessarily co-treat, but co-collaborate, if that makes sense. So we can share information and say, hey, I'm having this client, he needs this, but I'm struggling here. What do you recommend? Oh, I did this and this worked really well. So for instance, I had a client with autism, and he also had a physical comorbidity where he needed the massage therapy, but he had a very heightened sensitivity to tactile stimulation. So how do you help someone that doesn't tolerate the touch, right? Physical touch, right? Well, I soon figured out that if you incorporate a musical component, he started singing, and he kind of like let you grab his arm to play instruments. So I was able to do like a co-treatment with my massage therapist, and I said, hey, I'm going to start doing this hand-over-hand support, but the idea is to get you in there so he can get used to your tactile stimulation. Soon enough, we were able to work together to where the client accepted that tactile support from the massage therapist, and that was a very touching moment for the family. I mean, the parent was there observing. She just started crying because she said, years that we've been trying this, we have never been able to get my son to accept the service, and now you guys are doing this. And she didn't really know what we did or how we did it, but all she knew was that we were getting her son the care that he needed, right? So some of the areas that we work in mental health situations, behavioral health. We get a lot of at-risk teenagers that have a history of some sort of trauma, domestic abuse, and such. And we do, one-on-one sessions. We do songwriting, emotional support, those kinds of things that we help them process some of the things that have happened. And the bulk of our work is going to be developmental and learning disabilities. That's where we get basically a lot of our contract work is with that population. We also work with persons that have issues with substance abuse, so like alcoholism or drug addictions. We actually are doing that right now in Mexico. So Health and Harmony is providing services to clients from Brownsville all the way to Mission, and then in Mexico, Corpus Christi, and in San Antonio. So we're, everywhere, but wherever a door opens, we just like to walk right in and not afraid to take on the challenge. Telehealth is a thing because it started in 2019. Whenever the pandemic hit, we were worried about that. We were like, are we going to be able to continue to provide our services? And basically the contracts that we were working under, they were very gracious, and they allowed us to convert to telehealth. And then after that, it hasn't really gone away. Most of our services are in person, but people still request telehealth services. It just works well for some individuals. Let me see. Did it leave me out? Okay. Where am I? Can I go back to the other one? Yeah. I want to go to this one. Oh, perfect. Okay, so these are some pictures of some of the events that we have attended. Last year, I believe, we did the Salud Arte event that happened in Edinburgh. The city of Edinburgh has given us contracts to provide community music therapy groups. And so that was one of the ones that we attended. We also had an interview with a local news channel, Al Valle del Rio Grande. And so we did that one. That one was Spanish. And a few images of, there was a memorial service that we did for the babies that passed in the NICU in Harlingen. So we were able to go and provide the musical support for that event. And let me see, and drum circles. Drum circles are cool. I mean, we do a lot of that. We get a lot of invites for that. So I just wanted to mention real quick, I have a slide here about the instruments that we use. I have gotten actually requests. When I talk about music therapy, I get a family member. They said, "Hey, can you send me the music? Can you send me the music therapy?" And I'm like, "What do you mean?" Like, yeah, send it to me. Like, they think that it's an audio file that I'm gonna send to them, and they'll get their music therapy like that. Well, that's not the way it works. Music therapy is provided in a live setting with a musician, a music therapist. And so I tell them the way that it looks like is there's going to be an individual that's going to go, they're going to meet the client, they'll bring acoustic instruments, so they'll bring like a guitar, a ukulele, electric keyboard maybe, hand drums, and they're going to provide that musical experience. And in that relationship, they're going to develop, therapeutic goals. That's really the main difference between music making and just like music education. As you know, music education, music performance is, the goal is primarily the performance part, right? And here I like to think about it like, okay, there's a performance aspect, but the goal is actually a therapeutic outcome. So that's kind of the big difference there. There's no pressure as in like your client has to be like this amazing musician. No, because you're working on speech, you're working on communication, you're working on, emotional support, and they get to do music with you and you with them, so it's awesome. I am going to pass it to Mary Kate, and she can close up. Okay. Thank you.
Okay. Thank you so much, Luis. Another round of applause for him for coming out and sharing a little bit about his work. Also, I wanted to say thank you to Daniel for having me back out again this year. I know that last year we had a good time, and it was fun to come out and get to talk to you guys again this year. And thank you to Dr. Vaughn, my sister, for supporting and facilitating all of this. Most importantly, though, thank you all for coming and being so attentive and being willing to do body percussion with me at 11 o'clock in the morning. I do appreciate that. So round of applause for you as well.